Hi, this is Dr. Vivek and welcome to my YouTube channel. In this video, I would like to talk about polycystic ovarian syndrome, also known as PCOS. It is a condition that affects a woman's hormone levels, or in more precise manner, PCOS is a problem with hormones that affects women during their childbearing years. The word polycystic means many cysts. Polycystic means many cysts. And this many small fluid-filled sacs grow inside the ovaries. The common symptoms a female has when she has PCOS or when she's suffering from the polycystic ovarian syndrome is the disturbed androgen hormones. Testosterone are disturbed. That's why the woman will have a young lady. She will have more hair growth on the hands, on the face, on the legs. So this is one of the symptoms. And the hairs on the scalp gets thinner and starts falling. So if it's starting and you have the more hairs in your body, this means maybe you will have the polycystic ovarian syndrome or you are suffering from polycystic ovarian syndrome. The second symptom is irregular periods. It means some months you have the cycle of 28 days, another month it's of 45 days, another month it's of 60 days, and another month it is of 20 days. So it's irregular periods. This can be due to polycystic ovarian syndrome. The next symptom is headache and weight gain. So if you feel that now you are having constantly headache or you had headaches plus you are gaining the weight, this can be the symptom of polycystic ovarian syndrome. And the main cause of infertility in the woman is polycystic ovarian syndrome. So after knowing all of the symptoms, now let's move towards the diagnosis. How a female will know that she is suffering from PCOS. The first is ultrasound. Just doing a simple regular ultrasound where the doctor who does the ultrasound will check the ovaries, uterus and endometrium. He can see and he can tell you that you have the PCOS or not, because as I've said, he will see small cysts in the ovaries. So this means it is or it can be polycystic ovarian syndrome. Another test is blood test. Your blood is tested for various hormones, for example, thyroid function test, lipids and diabetic profile. This all will be tested, plus as I have said, androgen hormone. So hormones you have to also check. These all tests will tell you that you have polycystic ovarian syndrome or not. Now let's talk about Ayurveda, the holistic medical science, how it sees polycystic ovarian syndrome. According to the Ayurvedic principles, the polycystic ovarian syndrome occurs primarily due to the imbalance of the kapha dosha in the body. Kapha means more mucus or more water retention in the body. So in the general, I am telling you, it's a vast term. In the simple language, how you can understand is just you can relate it with the water component and the earth component. It's heavy. So this is the disbalance of the kapha dosha in the body. Ayurvedic treatment has a holistic approach towards the PCOS. Each patient is given a unique therapy based on the specific health needs, rather than a single remedy for all. We don't have in Ayurveda that, okay, this is the herb, it will treat PCOS, or you can say it as PCOD also. It's almost the same, PCOS and PCOD. So the Ayurvedic therapy in the women with PCOS looks for the detoxification of the body. And also with the detoxification, strengthening of the female reproductive system and rejuvenating the female is very important, and regularizing the menstrual cycle. It is very important. And what also is done is the hormonal imbalance is balanced. The weight loss techniques are told. This is how in Ayurveda the PCOS is treated. Ayurvedic treatment of PCOS includes the combination of the herb therapies and a healthy lifestyle to improve the condition of the PCOS. We have understood the dosha disbalance, what are the disbalance going inside the body, what are the practical recommendations that you will get through the Ayurveda. Doing exercises about 30 days every day, it is what Ayurveda recommends. It should be every day. Start with the moderate. I don't say from the starting just go and exercise it from like 30 minutes to 1 hour heavily. No, maybe it will give you bad effects. So what you have to do is increase moderately. If you don't do exercises, start doing exercises and start with the moderate exercises and then increase up to intensive if it suits your body. If it doesn't suit your body, then it's better to do moderate exercises and do it every day. Doing yoga and meditation also helps a lot in improving the condition. So what are the yoga practices that can be recommended in this problem? The first is pranayama. Pranayama, it's a yoga technique. You can just search on internet what is pranayama. You will get the whole list of videos telling how to do it, what to do it. It's like this, breathe out from another, and then from this you breathe in and breathe out from the another. This is how you continue. So this is what is happening is oxygenation of the blood is happening, and this will create the balance. Also, it will reduce the stress. This is also one of the big cause which makes the situation worse. So pranayama will help you in both the conditions. The another pose is Naukasana. Naukasana, also popular as boat pose, in which you make your body like boat. It's better to concern to a yoga practitioner who practices it every day. He will tell you in the proper way how to do the yoga for PCOS. The simple recommendations are do the pranayama and do the boat pose. The third yoga pose that I would like to recommend is, we all love this. If you know yoga, it's Shavasana. It corpse pose. So this pose also relaxes a lot. This indeed will give the effect to your endocrine system. The endocrine system will work good, hormones will be balanced, and in this problem, hormonal disbalance is the main cause. So balancing the hormone through the yoga practices will help. Benefits of yoga for improving the anxiety, hormones, menstrual cycle, and metabolic parameters amongst the women helps a lot. That's why I'm recommending you to do the yoga. This is my first video actually where I'm recommending to do the yoga. What Ayurveda more recommends is Panchakarma therapies. It's the detoxification of the body. It's better to just search on internet what is Panchakarma, and if you have the chance to visit Ayurvedic doctor near to you or do a Panchakarma, I will recommend you to do this. So now let's move towards the treatment. What Ayurveda recommends the treatment. The first treatment is detoxifying your body through the Panchakarma. Second is the yoga practices that I have told you. The third is the diet. So what we have to do is just search on internet Kapha diet. Kapha diet, just write. You will get whole list of products that you should eat and which you should avoid. What else I would like to recommend you as a doctor for the medicines that help. The first medicine that helps a lot if you are having irregular menses or if there is lots of blood flow is the plant name Ashoka. It helps a lot in balancing the irregular menses. I have a whole video about this, how to take Ashoka, what are the effects, its form in the tablet and the powder form. You'll surely get it on the internet. You can search about it. So Ashoka is the first herb that I would like to recommend. The second herb that I would like to recommend is start using Triphala. I recommend it many times because it is so effective. So if you are having the problem, start using the Triphala also. It also balances the body a lot. The last herbal medicine that I would like to recommend, it's very effective. If you are suffering, use it. This is Kanchnar Gugul. Kanchnar Gugul. 2 tablets 3 times in a day, 30 minutes after food. If you are not having any of the problems with the stomach, means you don't have gastritis, you don't have gastroesophageal reflexes, these kinds of things you don't have, then you can use Kanchnar Gugul, even 2 tablets 3 times in a day, empty stomach. If you have problems, then it's better to shift to the 30 minutes after food. Take these all herbs, whatever I have recommended, for 2 to 3 months, for surely you will get benefit. If you see that your cycle has been reduced a lot, it's better to use either Ashoka, either Pushyanuk Churna. Don't use both of them together. So Triphala, what you have to use, Kanchanar Gugul, this is what you have to use. Among Ashoka and Pushyanuk, I would go for the Pushyanuk Churna. The first choice will be Pushyanuk Churna. So do this all, it will help. Yoga poses will help. Whatever I have told before this, all the things you have to do. Only eating these herbs will not help. It will not help you 100%. 40%, 50% you will get the result, but if you want full treatment, it's better to change your lifestyle if you are having this problem. This is a general recommendation that I have tried to give you in this video. It's better to consult an Ayurvedic doctor near to you. He will know your constitution and will recommend you a proper whole course. These all medicines I use in my practice. They are effective. You can also use it. Stay healthy, stay happy.